education is the basics. It's just very basic information about Alzheimer's disease, memory loss, and dementia. Kind of help you have a deeper understanding of the different forms of dementia, different stages, and also the doctor diagnosis, what it means to have all the assessments taken and everything like that. But first off, if you don't mind filling out in front of you, there should be a sign-in form, handout to the slide, or a slide handouts, and then also at the very end there should be an evaluation. So if you don't mind just filling out the sign-in forms at this time, it really just makes sure that the Alzheimer's Association is diverse and inclusive, making sure that everyone who needs our help is reached, and also it helps us for when we apply for grants to help continue doing education. So, does everyone have the handouts? Is there anyone who doesn't? I see that most of you have finished, so I'm going to go ahead and get started. Please feel free to continue filling that out. This is informal, so if you guys have any questions, feel free and ask them. During this presentation, we have different clips of videos. We have people who have been impacted by this disease, whether it's the person themselves who has the form of dementia, or it could be their caregiver, or this clip is about Ron Peterson. He is a very well-known scientist and a director at the Mayo Clinic Alzheimer's Disease Research Center. So we're going to go ahead and listen to him. These clips are fairly short. Let me know if I need to turn up the volume a little bit or turn it down.
In general, we talk about in individuals age 65 and older that people have perhaps an 8 to 10% risk of developing Alzheimer's disease over their lifetime. But it's clearly age-related. So if your family tends to live into their 80s and maybe 90s, your risk is going to go up rather dramatically. On the other hand, if people in your family tend to die in their 70s, the risk is lower. But it's clearly an age-related phenomenon, and with baby boomers, now those individuals born between the years of 1946 and 1964, moving into their 60s, this is going to exaggerate the number of people eligible, so to speak, for Alzheimer's disease rather dramatically. Some people have indicated that if we do not do something for Alzheimer's disease, meaning delay the onset, slow the progression, ideally we'd like to cure the disease, but even if we have these modulating effects on Alzheimer's disease, it as a single entity will bankrupt the healthcare system as we know it, because there are so many people in that age who will need services, will need extra care, that this will bankrupt the system.
That's a pretty powerful statement that he just made. If we don't do something to help slow this disease down, prevent it, cure it, it's going to bankrupt our current medical system. Because right now, the boomers are reaching that 65 and older age, that because of that wave moving into that age group, we're going to see a lot more people develop this disease. And so it's just going to continue to grow and almost grow out of control. So as we age, our bodies age with us, and so do our brains. You know, we find it difficult to run and lift and move the ways that we used to do when we were younger. And our brain is the same way. It loses some of that agility that it once had. However, you know, typical age-related changes, as you can see, we all make bad decisions every once in a while. Missing an occasional payment. We get busy in our busy daily lives. Forgetting which day it is and remembering it later. Now, these are typical age-related changes. However, somebody who has Alzheimer's disease, they won't remember, you know, they have trouble remembering what day it is, let alone what season or what year it is. That's impactful. So a typical age-related is we might forget to do something or might forget a famous person's name, but later on we're able to recall what it is, what we're supposed to do. However, somebody who has Alzheimer's typically won't remember it in that time frame of that conversation and won't remember it later on either. So there are differences. Here, this is Joyce. She has Alzheimer's disease, and she talks about the early stages that she noticed in herself and the warning signs that were not a part of typical aging.
I noticed there was a time when I was dialing the phone and the buttons were, I couldn't dial the phone. And so I went to the neurologist, and she said, they said that they didn't, I did some tests, and they said it didn't seem that anything was different. But then a couple of months later, I noticed that not only could I not dial the phone, but I was having difficulties writing. I was having difficulty spelling simple words like of and the. I was falling a lot. I began to have accidents, like minor accidents, driving accidents. And at that time, my husband said, you know, we're going to the doctor.
So Joyce explained some of the changes that she noticed in herself. And one of the things that the Alzheimer's Association did was come up with Know the 10 Signs, which is an early detection program, making sure that people are aware of the 10 signs and making sure that they get that early detection so they can get an early diagnosis. And so I'll lightly go through the 10 signs. So memory changes that disrupt daily life. Again, that's a big one. It has to be something that's interrupting their work life, their hobbies, changes in planning and solving problems. So here, a good example is my grandmother, who she remembered all of the family recipes, all stored up in her head, never had to break out a recipe card. And she would always make a family dinner every Sunday for us. And these meals would be immaculate, just so delicious and impeccable. So as time went on, we noticed that some of the food maybe wasn't prepared correctly, like she was adding maybe an extra ingredient, or one time she forgot sugar in the chocolate pudding. And so we noticed she started making small changes. And then we noticed she had to start getting out the recipe card because she couldn't remember which ingredients were in there. And then it slowly progressed into now she was having even trouble following a recipe card. So that is a progression. Obviously, at first, you know, we just thought, oh, she was busy, simple mistakes, but you can clearly see that decline. Difficulty completing a familiar task. This one, I like to think of somebody who used to play cards, you know, bridge or pitch, and great player, but then now they're starting to make simple mistakes that you don't typically make, and then it becomes more and more challenging for them. And eventually, they'll probably withdraw from that because now they're making so many mistakes, they don't want others to see that, which kind of This one, somebody who is typical aging, even myself, like if we have a holiday off, my week is thrown off the whole entire. I keep on thinking, it's Wednesday, but it's actually Thursday. That's typical. But somebody who has Alzheimer's disease may not even remember what season it is, what year it is. That is not typical aging. Trouble with visual and spatial relationships. You heard Joyce talk about driving. Driving is a major concern for somebody who has dementia and Alzheimer's. They have troubles that the disease affects their judgment and reasoning, so they can't effectively judge how fast that car is going and if they can safely turn in front of that car. So you'll start to see more and more driving accidents. New problems with words and speaking or writing. Joyce talked about she couldn't remember how to spell duh or up. Very simple words. Also, another good one is, we all get into a conversation, and I can't remember, the actress's name, but it hits me at 2 o'clock in the morning that, oh yeah, it was blah, blah, blah. But somebody who has Alzheimer's disease isn't able to recall that. Even if you said the correct word, they still could be, no, that's not it. They're not able to come up with another word that's similar to that. Misplacing things and losing the ability to retrace steps. A great example here is, let's say if I have my hands full with groceries, I walk in, put all my groceries away, and then I need to find my keys again and I can't find them. So I'm able to retrace my steps. I'm able to go into, if it was the dining room, nope, it's not there. The kitchen, nope, it's not there. Bedroom, oh, there they are. So I'm able to retrace my steps. But somebody who has Alzheimer's disease can't retrace their steps. And so that's why, as you see the disease progresses, if they always put their wallet on the counter and it's not there, they start accusing their family members or loved ones because in their mind, they do not remember placing it over there. And so that's why you get the accusing. Decrease of poor judgment, again, it's not just a mistake that happens, once in a blue moon. It becomes more and more of an occasion and a recurring. Withdraw from work or social activities. Here, again, a lot of times people with dementia or Alzheimer's disease, they know something's wrong. They may not be able to tell you exactly what's wrong, but they know. And so a lot of times they don't want other people to see what's wrong with them. So they're going to withdraw because they don't want their loved ones or friends or families knowing that there's something wrong. And changes in mood and personality. How frustrating is it if you can't remember short-term things? It would be very frustrating. And so you see their mood and personality change throughout the progression of the disease. So dementia, we'll move into what is dementia? What's the difference between dementia and Alzheimer's? So dementia is an umbrella term. There is no actual disease called dementia. Dementia is a condition, it refers to a condition that is caused by many different diseases. So it's a condition that's caused by many different diseases. So Alzheimer's describes the symptoms that occur when the brain is affected by a specific disease or a medical condition. So something is causing the dementia. Something is causing a cognitive decline. And as you can see, Alzheimer's disease is listed under dementia. You have many forms of dementia. Some are reversible and some are progressive, like Alzheimer's disease. The different dementias, how they make up, how they progress, depends on what form of dementia it is. Somebody who has Alzheimer's disease is going to have different symptoms than somebody who has Lewy bodies disease. Now they may overlap a little bit, but there is distinguishing between the two. And it's very important to know which form of dementia you have. So again, a loss in cognitive functioning that is severe enough to interfere with daily living. So it's impacting their home life. It's impacting their hobbies. If they're still working, they're having issues with maybe keeping up. But dementia doesn't always just cause memory problems. It can cause many other issues as well. So it could be with language, thought, behavior, mood and personality, executive functioning, which is planning and organizing. So depending on, again, what form you have, it can impact a lot of these different things. And one saying that we like to say is, if you know somebody who has Alzheimer's disease, you know one person who has Alzheimer's disease. Each person is a little bit different. And unfortunately, that's what makes it a gray area. They may have some overlapping symptoms, but each person and how they progress is going to be a little bit different from each other. I'm going to stop there and ask if you guys have any questions over what I just went over. Yeah?
Dr. Mayo mentioned about age-related over 65. It's really onset occurred that where individuals younger than that start having symptoms. Is that genetics or?
Yeah, so there is younger onset and then there's later onset. And you were talking about later onset is over the age of 65. Younger onset is usually that 40s and 50s. The younger onset, again, they don't know what causes Alzheimer's disease, so I can't give you that answer. There is a genetic trait to younger onset, and I'll touch a little bit more on that later on. But again, they don't know what's causing this. Great question, though.
Is that the same for all types of dementia? Is there?
Depending on what form, they don't know what starts it, but they know what's going on. So there's, let's see, what's the next slide? The next slide, Alzheimer's is going to be your most common. It makes up 60 to 80% of all cases. And I think that's why Alzheimer's gets so interchangeable with dementia, is because you hear about it the most. But you have vascular dementia, which vascular dementia usually is caused by a stroke. A lot of times, if you've ever seen somebody who has a stroke, they're very impaired right after that stroke, but then the brain is miraculous and it can regain some of those. It can learn some of those tools that it once had. Usually they're not able to recover exactly back to what they were at, but pretty darn close. But vascular dementia, what happens is, depending on where the stroke is caused, that where it happens in the brain, that depends on what symptoms they're going to show. So two people with vascular dementia can have very different symptoms. And usually there's like a time period after a person has a stroke. After XYZ time, if you don't regain those strengths, then you most likely won't get them back. And so that's what happens with vascular dementia. But there's Lewy body dementia, there's front temporal dementia, also known as PICS, that's familiar. But there's also Parkinson's dementia. So Parkinson's disease, if you have Parkinson's, you have a higher risk of developing Parkinson's dementia. And Lewy body and Parkinson's are very similar to each other, but there are distinguishing factors. Like in Lewy bodies, usually they have hallucinations of adults, kids, animals. Also, their sleeping habits are usually more disruptive than somebody who has Alzheimer's disease as well. But, I mean, to answer your question, we don't know, I guess, what starts it, but there's a couple different factors that can cause, I guess, a form of dementia. Do you guys have any questions over that? Okay. So mild cognitive impairment. This is a condition when a person has troubles with memory, language, and other mental functions that's severe enough to be seen through by other people or even show up on tests. However, it doesn't disrupt their daily life. And so it doesn't qualify it as a dementia. Dementia is when it starts disrupting their daily life. And so this is kind of a precursor to dementia, so to speak. I would say, I think a lot of our elderly might have a little bit of cognitive impairment. Just because, again, as we age, we lose some of that ability. But you shouldn't have issues like with Alzheimer's disease. So if you do have mild cognitive impairment or MCI, it does give you a little bit greater of a risk of developing Alzheimer's disease just because that damage has been done to the brain. It can easily move into Alzheimer's disease. But again, it does not mean that you will develop Alzheimer's disease. They can be happily forgetful is what I kind of like to call this stage. There is no treatment available for MCI approved by the FDA. So there's really no treatments, unfortunately, available. So Alzheimer's disease. What is Alzheimer's disease? Again, Alzheimer's disease is the most common form of dementia. 5.2 million people in the United States have Alzheimer's disease. 1 out of 9 over the age of 65 will develop the disease, and 1 out of 3 over the age of 85 will develop Alzheimer's disease. Those numbers are pretty staggering if you think about it. And every 68 seconds, somebody is diagnosed with Alzheimer's disease. So Alzheimer's disease is a disease of the brain that causes problems in memory, thinking, and behavior. It is a progressive disease, and that the symptoms vary, but usually the first problem is forgetfulness. Alzheimer's is progressive, and it is a fatal brain disease. So somebody who has Alzheimer's will die from this disease. Unfortunately, there is no cure, no prevention, and no slowdown. But there are treatments to help the symptoms that come along with Alzheimer's disease. But again, those treatments don't slow the progression of the disease down.
Question for you.
Yeah.
So you talk about being eventually fatal. I mean, is it because the brain shuts down as far as its processes and telling the body what to do?
Pretty much. What Alzheimer's disease is, the neurons that are in your brain pretty much die off, and it will literally shrink the brain because they're dying off, and eventually it will get to the point, and I'll go a little bit deeper into that, but it will get to the point where it starts affecting like your breathing, your swallowing, your and that's how eventually it will, I guess, what happens with the progression. So, Steve has Alzheimer's disease, and he talks about the early signs that he noticed in himself.
But the types of things I noticed had to do with organizational abilities, mental abilities, and I was getting confused. I was finding it hard to plan, and there were two pivotal sort of moments that really brought this home to me. And the first one happened when I went into work one morning and sat down at my desk to plan out my day and couldn't figure out what to do, and literally sat there for an hour frozen and could not figure out what piece of paper to pick up first.
How terrifying would that be? Sitting there not knowing what to do next. I can't imagine the feeling that he was going through. But let's talk about how the brain works. So there are over 100 billion nerve cells in the brain called neurons. And these neurons form connections with each other. They have communication that they send back and forth, making these branches. And these group of neurons have special jobs. Some help us with thinking, learning. Others help us see, hear, smell. Others tell us when we need to move our muscles. And so the brain operates like a tiny factory. It receives the supplies, generates the energy, constructs the equipment, and then gets rid of the waste. And our brain is very much like that. Scientists believe that Alzheimer's prevents parts of the brain from working correctly. And just like in a real factory, if you have any backup or breakdowns, it creates issues in other areas of the factory. And that's exactly what happens with somebody who has Alzheimer's disease. Alzheimer's disease, these neurons, because they can't do their function, they can't communicate with each other, they slowly start dying off. And that's what creates that shrinkage of the brain. In the next clip, or slide, you can see different parts of the brain. And Alzheimer's systematically moves throughout the brain. So it controls the memory and language, usually first. And then it moves to the hippocampus, which that is the temporal lobe. And that is kind of the movement and balance, but also it moves into the language, sense of temperature, pain, vision, judgment, reasoning, and then lastly is the basic functions. So somebody who has Alzheimer's disease, they may have issues with remembering who their loved ones are. They may remember or have a hard time remembering the types of language, using, they may be able not to remember how to spell words or be able to communicate verbally or written. But they start to lose that conversation piece. They can't tell you what they need. And one big thing is the sense of temperature. A lot of people don't realize this, but that's where I think, they don't know what season it is. So they might go out there in 90-degree weather with a fur coat on. Well, they don't have that capability of saying, it's hot out here, I need to take my coat off. And so somebody who has Alzheimer's disease, you have to be particularly aware of their surroundings for them to make sure that they're not, the temperature is not too hot or too cold. So in advanced Alzheimer's disease, most of the cerebral cortex, which is all of the lobes together, again, shrinks. And Alzheimer's disease, lastly, affects the basic functionings, which is breathing and swallowing. So typically you see somebody in the later stages of Alzheimer's disease have issues with swallowing, and so they quit eating at that point because you can't remember how to swallow. Aspirating is a huge problem in this later stages as well. So here you can see a healthy brain on the left and severe dementia on the right, and you can see how your brain starts deteriorating because of Alzheimer's. Do you guys have questions over what I just went through? It was kind of a magnitude of different things.
I have a question about how it's tested for, how they do tests and what it is.
Unfortunately, there's not one test that determines whether or not you have a form of dementia. And so you really have to go through a thorough diagnostic testing. And I'll get into a little bit more on what that means, but there's a multitude of things that they have to look at. But great question. Somebody who has Alzheimer's disease can last anywhere from 3 to 20 years. Typically, after onset of the symptoms, it's usually 8 to 10 years of living with this disease. So you can see how our current medical system can't hold that many people with the disease because they have it for generally a length of time, and they become more and more dependent on other people around them. And usually, that middle to later stage, they really need 24-hour care. So Katie does a great job talking about Bill, her husband, and how difficult it can be to get diagnosed. Unfortunately, the disease moves so slowly. It's such a slow decline that it's not you wake up one day and you just automatically know this is what's going on. It's a very slow progression.
Bill had been a graduate student for an advanced degree, and he found himself having difficulty defending his thesis, the last thing that he needed to do. And he started making mistakes at work. We both somehow knew before he was diagnosed that something was very wrong. At first, we hoped it was something that they could either operate or cut out or burn out or something, or maybe he was depressed. Maybe he just needed a nice weekend and it would be fine. And then we realized maybe something's really very wrong. And it was. We went through several doctors, several unsuccessful attempts at getting some sort of diagnosis. Each time they would test Bill, he would ace their tests. If they wanted him to count backwards by 3, he could count backwards by 3.25. His problems were very, very subtle. And when we finally realized he was laid off from work, and I'm sure that was part of the reason why he was laid off from work. But during the election, when we elected a brand new president, although Bill wasn't working, he wanted to be active. So he volunteered to work at the polls. And he was an officer of the election. And before he left, we were very, very excited about it. It was a long day. It was 5 o'clock in the morning. And we knew no matter what happened, it was going to be a historical event. So we were very, very excited. We would either have a female vice president or an African-American president. One of the two, and it was going to be huge. So we were excited about it. He went off, worked at the polls, came home and told me, and we were very animated, talked about the people all the way around the block waiting to vote. And we were so excited, we stayed up and watched the acceptance speeches, and we found out who won. And we thought that was just amazing, and it was history. So the next morning, we got up and Bill said, I got to get the paper. I said, why? And he said, I got to see who won. And we both realized, uh-oh, he lost the whole day before because it was such a long day. And that was when I realized how serious it really was.
So again, the diagnosis is not always easy to come up with. And that's why I kind of like showing examples how it's not just one thing that indicates that you have this disease. It's a multitude of different things. So what are your risk factors? Your greatest risk factor is age. That 65 and older, again, somebody who is 65 and older, it's 1 in 9 get the disease, and it's after 85, it's 1 in 3. So age is going to be your greatest risk factor for Alzheimer's disease. However, us women tend to live longer, so we have a higher chance than men. However, men are starting to close that gap because they are living longer. But also family history plays a part of it. If you have a loved one with the disease, brother, sister, parents, grandparents, you do have a higher risk of developing Alzheimer's disease just because that brain has been damaged. And there is a genetic link as well. There's actually 2 genetic links. One's linked to the younger onset, one is linked to the later onset. The younger onset is very, very rare. And the families who do have the younger onset are very much aware because it's Usually their parent has it, their siblings generally have it, their grandparents have it. So it's very prominent in their family. So I don't know if any of you have seen Still Alice, but it was in the movie theaters and will be out again, so don't worry, you have time to see it. But it's about a younger onset, and she has 3 children, and 2 of the children got tested. One of them had Alzheimer's disease, the genetic trait, and then one of them didn't. And so with the younger onset, if you do have the genetic trait, it says you will develop the disease sometime in your life. They can't tell you when it's going to happen, but you do have that link which says you will get it. The later onset, if you have that genetic link, it just says that you have a higher risk. Again, anytime it's in your family, it is a higher risk for you. Head injuries play a role into forms of dementia. We notice that our soldiers, our football players, our boxers, anybody who's getting beaten, a lot of head injuries, they have a higher risk of developing the disease as well because you're damaging the brain. And anytime you damage the brain, it just makes it that much easier to kind of get that on switch going. Also on here it says Down syndrome because they have an extra chromosome. We're noticing they're living longer as well, and so that the extra chromosome has a part in this as well. There is a huge connection between heart and brain. Whatever is good for your heart is going to be good for your brain. And if you have family genetics that give you that high blood pressure, give you that high cholesterol, heart disease, diabetes, you have a higher risk of developing Alzheimer's because if your heart gets damaged, your heart is pumping and nourishing your brain. And so if something damages your heart, it's going to have implications on the rest of your body. Little, big, but it's going to have some kind of implication. Do you guys have questions over the risk factors? Okay. So selecting a doctor, the Alzheimer's Association, we really advise people to go to their primary care. Start with your primary care first. But your primary care can do some forms of testing, but hopefully they'll kind of pass you on to a geriatrician, a neurologist, a psychologist. One of those can really help further and explore into the disease a little bit better. But make sure you find somebody who is well diverse in this. Just because they're a neurologist does not mean that they're up to speed on the different forms of dementia. So find somebody who's knowledgeable about the forms of dementia. So preparing for a doctor visit, what I advise anyone, let alone somebody who possibly thinks they have has memory issues or thinks they might have Alzheimer's disease, write a list of symptoms. When it happens, how often it happens, where it happens. But also for family members to do this too. If you're noticing things in your loved ones, write it down. A lot of times I tell them to give it to the physician ahead of time so they can read it, go over it, and that way you're not confronting your loved one in the middle of that doctor's visit and say, I think you have some memory issues and these are the reasons why, because it hurts their feelings. So write the doctor ahead of time. That way he's controlling that appointment and he can kind of dictate where it needs to go. Also, always bring a list of current and previous health problems and also medications. Make sure everyone here should do this. Make sure you have a list of your prescriptions, but also if you're taking something on a daily or weekly basis and it's a vitamin, herbal supplement over the counter like Tylenol, if you're taking that every other day, you you need to make sure it's listed on there, because if those medications that he prescribes conflicts with one of those, it can really cause a lot of issues. Oops. Okay, so for the assessment piece, what they do is, again, there's no single test that determines whether you have Alzheimer's disease or another form of dementia. So there's a multitude of assessments that they go through. They look at medical history. What is your past medical history? You know, do you have heart disease? Do you have high blood pressure? Have you had your appendix out? What have you? Mental status evaluation. Again, this is kind of evaluating, testing your short-term and long-term memory. Again, like in her test, they'll ask you to count back usually by 7. They'll generally do a clock test where they'll tell you to write or show the hands at, usually it's 2:45. And also your language, motor skills. They do a physical evaluation because here they want to look for, is it an infection that's causing this cognitive decline? A lot of times urinary tract infections, pneumonia, those really have implications that can have side effects that affect your memory. Also, they do a brain scan. They're looking at, is there swelling in their brain? Is there a brain tumor? A multitude of different things. And then a psychiatric evaluation. They're looking at, is it a form of a mental disorder? If you have depression, it can mimic the symptoms of Alzheimer's disease. And once you get on the proper medication, it can reverse those side effects and maybe diminish them altogether. Also, they do interviews with the family because they want to get the family's perspective. What are they seeing in their loved one? Do you guys have questions over anything so far? No? Okay. So when the diagnosis is Alzheimer's disease, emotions run high. You know, a lot of people feel denial or anger. A lot of caregivers that I talk to feel grief because they lose a part of their loved one every day as the disease progresses. So they feel grief as their loved one, you know, as they're losing a little bit of their loved one. Some people feel fear and shock. And some people are, you know, relieved because now at least they have a diagnosis, they have a direction, and they can start planning for their future. So I'll go through the stages of Alzheimer's disease. So we have 3 stages: early, middle, and late. And so for an individual who's in the early stages, you may start to see some recent memory loss. So it usually is that short-term memory. Either they can't learn a new skill or they're having trouble with daily activities. Maybe they're making a lot of notes for themselves more than they used to, or relying on other people more than they used to. Difficulty managing money, that's a big one. A lot of people see it in their spouse when they used to control the checkbook all their life, and now they're making minor mistakes, whether they can't add or subtract the balance anymore. Paying the bills. I've had one person say that their loved one used to pay the bills 3 or 4 times because they couldn't remember if they paid it or not. Or vice versa, they don't remember getting the bill, they put it away, and then they never end up paying it and have issues that way. Driving and social situations. Driving is a huge concern because with the disease and because it progresses, it affects their judgment and reasoning. And again, if I had a person say that their loved one couldn't remember which light to stop at, so they were stopping at all the green, yellow, and red lights because they couldn't remember which one they needed to stop at. Or I had another gentleman who his wife was driving on the interstate and decided to go 100 miles an hour. He said after that, she could drive anymore, and she gave it up kindly, but some people, unfortunately, it is an independence thing. And so it is hard for them to, you know, let go of those car keys. But you also have to look in the best interest of them, but also the others around them. You know, if insurance, if they've been diagnosed with Alzheimer's disease and they get into a car wreck and their insurance knows that they have Alzheimer's disease, there could be a huge lawsuit because of that. Middle stages. So if somebody's having trouble with words and with speaking in the earlier stages, you're going to see it more pronounced in the middle stages. If they usually have issues with keeping track of their personal items, so this is where you see them accusing their loved ones of stealing things from them or caregivers. Also, may need help with grooming. Here, you know, if they were a well-kept person, they're not going to have that judgment and reasoning to use anymore. And so their appearance might they might not put as much time into their appearance as they once did. A lot of bathing issues gets thrown to frame here because they thought they just took a shower that morning, so why do I need to take another one again? Or I had one yesterday, so I don't need to take another one. Late stages. This is where you see their short-term and long-term being affected. As the disease progresses, the disease takes that short-term away first, and then it starts moving backwards in time. And so usually in the later stages, a person will talk about their mom and dad a lot because that was the earliest memories that they have. Or they might talk about a loved one who has been passed away for several years. Again, those are that long-term memory. And also, as the disease progresses, their cares, they'll become more and more dependent on helping with their cares, their grooming, bathing, dressing, eating. They a lot of times will forget to eat. They don't generally have that hunger sensor anymore like I do at 12 o'clock. It's time to eat. So they'll lose that as the disease progresses. Do you guys have questions over the stages of Alzheimer's disease?
I have a question. You talked about concussions and those kinds of things. What about the other vices, like smoking, drinking, drug, marijuana, uses like that? I assume that they're all contributing factors.
Yes, yes. A neurologist put it in a very good way, and I love sharing what he said. And he said, anything that you do to your body, good or bad, has an implication, good or bad. So if you do drugs and alcohol, it's going to have an implication. And yes, we do see, you know, if they have high alcohol or drug use, they can develop Alzheimer's disease as well. They have just that higher risk of it.
Well, is it developed earlier then, or if you are a non-drinker or smoker, does it that still have the genetic capability to manifest itself later in life then? Or?
That I can't answer. What we really promote is, you know, healthy eating, exercise, social interaction is big, and always stimulating your brain. Now, you can do that very easily. You know, if you don't like doing crossword puzzles or Sudoku, you can train your brain or learn a new instrument by, you know, picking up an instrument and teaching yourself how to play. Also, have you ever brushed your teeth with your non-dominant hand? How difficult that is? That's, again, stimulating that brain. Taking a different way home from work. You know, we all get in our set routines, but taking a different way home from work makes our brain trigger. So all of those are important factors, and that's what we really promote is you know, that healthy eating, exercise really helps with, you know, it doesn't mean you won't develop the disease, but we see people who, if they do that, they have a lower chance of it happening. So Monica Parker, she is a geriatric specialist at Emory University, and she talks about the importance of planning early. If you do have the disease, and making sure that you include your loved one who has the disease in the decision making, especially in the beginning.
One of the things with respect to caregiving, and a lot of patients, families, and I count myself in this group, we're baby boomers. You know, we're used to things the way we want them, and everything's conveniently disposed of, arranged, whatever. But it's not so easy to try to take care of your aging parent who lives 5 states away. And one of the things that most of us have not dealt with is who's going to take care of mommy, who's going to take care of daddy, how am I going to manage her business affairs, who makes decisions for what she wants to do for her health care. I don't think that those are decisions and discussions that most families have early enough. We have them in crisis, but we don't do them early so that we know what the game plan is. And if there's anything that I think that all of us should do is have a discussion with our parents, both of them, one of them, whichever one is available, early enough on to say, how do you want things to go if this happens to you?
You know, one of the hardest questions that I get is, why go to the physician if I'm suspecting that I have Alzheimer's disease? Why do I want to know if I have Alzheimer's disease? I can just live happy without knowing. And it's a hard question to answer, but one of the greatest gifts that you can give your family is planning and making sure that you have your plans put in place, making sure that you have all your legal, all your financial, as you all know, and making sure that you have all of those put in place for your family members, because, you know, a crisis will come up and you can help ease that crisis if you have those things. But if you don't, unfortunately, it's just going to create even more chaos. Also, one thing that we tell caregivers and loved ones is making sure that you have a support system, because no one person can take care of somebody who has Alzheimer's disease. It is too big to put on one person's shoulders. And so they need to have a support system, whether it's their family